In this video, we're having a look at the inner thigh lift. This lift addresses the inner thigh area. It's most commonly done in my post-weight loss patients. For any thigh lift that I do, I initially do VASER liposculpture. This includes 3 steps. First, I inject the wetting solution containing local anesthetic and adrenaline. Second, I do the VASER liposculpture, and then third, I do the liposuction, which is basically removing the fat. The liposuction areas are marked out before surgery, and there's commonly bulges around the knee area that you can see in this image as well. As that comes in the canister as well. And I just do a little bit of cleaning on the canister. To get a great result, we want to remove as much fat as possible from the inner thigh area. So we want to get front and back as well as the side bits. I can be quite aggressive underneath where the skin is to be removed because we don't have to worry about issues there. Now, there's always a balance when you remove loose skin. We don't want to make it too tight because then we got complications, but we want to make it tight enough to get a really good result. There's always going to be looseness that comes up 6 months after surgery. To make sure that I am not taking too much skin, I mark the skin out before I cut. So it's like a trial closure. So the skin should be really tight, but allow a bit of looseness to come up later on. I'm removing the superficial part of the skin. We have removed all of the deep fat with the liposuction prior to removing the skin. The skin usually comes off quite with minimal resistance at this stage. I use a tissue glue that minimizes bruising but also minimizes the chance of seromas. Seromas are fluid collections that can occur in tissues after you cut them out. Initially, I do interrupted sutures to close the thigh. Then I come back and do further sutures deep and superficial for the final closure. Initially, the closure looks really tight, but as I close progressively, it looks nice and a lot smoother once the superficial layers are done. The process is identical on the right thigh area. I want to make sure that I remove a similar amount of skin and fat on both sides to get an even result. This is the VASER machine. It shows that I'm using 80% strength on a continuous setting, and I have been vasering for close to 30 minutes at this stage. The VASER melts the fat and allows me to be more gentle with the tissue removal, fat removal when I do the liposuction. I can also get the VASER probe much closer to the skin surface to get rid of more fat from the thigh area.